So the Omicron variant of the COVID virus, that is a thing that has really been kind of hitting up on the news a lot lately. Not a lot of answers, but there are a lot of questions. So let's go through the things that we think that we know so far, right? The questions are going to be, what exactly is the difference of this Omicron variant? Does this make it more infectious in the sense, are more people going to get it? Is it more dangerous? Can I still test for it using the current tests that we have? Does my either natural immunity or the vaccination immunity that I got for other strains transmit to the Omicron? Like if I got sick with Delta, do I still have some protection against Omicron? If I got the vaccines that were designed for these other strains, do they still work for Omicron? And then just on a practical level, well, what do I do as just a normal human living in the world while everyone's freaking out about Omicron? How do I try and protect myself? So let's run through those things first. So Omicron is another variant, okay? These viruses, particularly the type that the coronavirus is, have a tendency to mutate and change. It is kind of what they do. And the thing that makes Omicron kind of stand out more than other strains is the fact that there is more change. It is objectively more different. There are more places of difference on it than other strains have had. That's kind of it, right? That doesn't absolutely mean, just based off that it's going to necessarily be significantly more infectious. It doesn't necessarily mean that it's going to be significantly more dangerous. It is just different, and we're still trying to figure out what that means when it gets exposed to a large number of people. The next question would be, is this more infectious? We really don't know yet, right? So this is new. It is something that was just really, truly identified a couple days ago at this point by Dr. Angelique Coetzee. Doctor, please forgive me if I mispronounce your name there. She is a South African doctor who I think did a wonderful thing, incredibly smart move. She noticed all of a sudden a number of her patients were having very different symptoms and were still coming back COVID positive. They weren't cold and flu symptoms. They were more extreme fatigue. It wasn't the stereotype loss of taste and smell. So it just looked different. And so when she went to go and request a genotyping, which is not something everyone does, then she noticed that this was a different thing, and they realized, okay, we have a different strain here. So good work on her part, because that is not something that everyone would have thought to do. I know that I've been treating COVID patients in hospitals since COVID came out as part of my job in one way or another, and I've never ordered a genotype for a patient because it was never relevant to what I was doing at the time. But good for her for catching that. And at this point, it has already been found and genotyped and confirmed in 3 or 4 European countries at the time that I'm recording this, at least that I'm aware of. So yeah, it is spreading. You might have seen some of the news that many governments are considering shutdowns. Between you and me, this is just a guess. No government is asking my opinion on this, but I don't think that is likely to stop this from spreading if it is infectious enough to spread. The notion, I think, given particularly this happened on a holiday weekend, really, and that we are such a global community with people traveling back and forth, the notion that any country is really going to be able to really block this off and somehow protect their economy, I find to be unlikely. And so I think it's important that we just kind of work on all of the protective measures that we can take and understand that if this is a truly infectious variant, then it's probably just going to be there. We're just going to have to navigate it, and that we can't all just not go outside and not go near people. So nonetheless, let's continue talking about, is it more dangerous? That thing, we don't actually 100% know full large data yet, but I'll include a link below where Dr. Angelique Coetzee, again, forgive me if the pronunciation was wrong, where she was talking about how so far she's noticed the symptoms to be mild and that she was not actually admitting a lot of these patients, which is good. Most of these symptoms she was describing were fatigue and not the extreme shortness of breath, hypoxia, the low oxygen levels that often get people admitted to the hospital for the Delta strain. So maybe less dangerous, who knows, maybe more dangerous. Well, once more people get infected with it, unfortunately, that is when we will really find that out. Luckily, so far, to the question of testing, it does seem that current testing does seem to identify infections with this. Now, the question will be when we can determine sensitivity and specificity, like is it missing some, and that sort of question. But so far, it will at least catch some of them, as proven by what Dr. Coetzee was finding down in South Africa. The next question is, will the current vaccines or natural immunity from other strains transfer and convey immunity or protection from this particular one? That one we do not know the answer to yet, right? Currently, Moderna, I believe it's Moderna, I'll include the link below, pharmaceutical companies are already working on more tailored vaccine options for this particular strain. We'll see if that ends up becoming really necessary or not as we do more studies. But this is in terms of like we talked earlier, this is more different. There is more variance here than there were with other strains of COVID. And so it is possible that we might require, in order to get the true level of protection, if this ends up being a serious disease state, that it might actually need to get a different booster or a different vaccine specifically designed for the Omicron. We'll see how that goes. We just don't have the answer yet. The last question is, well, okay, so I'm just a person living in society. Maybe I'm not a researcher like Dr. Coetzee. Maybe I don't work at the Center for Disease Control. I'm just trying to live my life and trying to be as safe as I can. What do I do? And at this point, I think the answer is likely the same thing that it was a week ago before we knew Omicron existed, right? So far, the current vaccines that are out show pretty good data for avoiding severe disease and death from the coronavirus. So most people, almost everyone, does not have severe life-threatening allergic reactions to the vaccine and its components. So most people would benefit statistically by getting vaccinated. We also notice that certain things do seem to have an increased risk factor for bad outcomes with COVID, and that would include people who have significant weight issues. So try and work towards getting to an appropriate weight. Uncontrolled diabetes has some issues as well, so try and get your diabetes under control, get your hypertension under control, stop smoking. Basically all the normal healthy living things that we would suggest to you otherwise that might make you increase your longevity in life. A lot of those things do convey to, man, I'm also more likely to live through a COVID infection. So consider just handling your health in general. The other thing is like, well, maybe I'm having trouble with my stress, my emotion levels around this sort of thing, and this is impacting my mental health. So check in with your behavioral health specialist, whether that is a psychiatrist, psychologist, therapist, whoever it is that you see, your primary care physician. Make sure that you're handling your emotional approach to all of this. I think it's important to understand that at some point, all of us are going to face death. That will happen to us. Will coronavirus be it for most of us? The answer is probably no. And you still have to worry about just living your life, right? So life is still an important thing to live, and it is too short to live in all-encompassing fear. So the things that you would like to say to people, go ahead and say them. Enjoy your life. If you want to go and start an activity, then start the activity. If there are thank yous, if there are I'm sorries, if there are I love yous that you have been holding unsaid in your heart, go ahead and let them out. Practice just being a happy person and trying to live your life in a good way. And that is about all that we can do, because at the end of the day, we can't control everything else around us. We can only control the way that we react to it. So we will have more answers about Omicron in the future eventually. Right now, the answer is we literally do not have a ton. Should you be changing your life in terms of stressing about this? I would find that unproductive at this point. So do the things you can to try and be safe and be happy. But until then, we'll have more answers when we have them. See ya.